Good evening. My name is Luckyboy Mkhondwane, as introduced. Just in case if I don't finish, the information that I'm presenting is available in a pink book at the back. Right. So just to give a background on the work that we're doing on treatment literacy, we started a project that is called Modern Art for South Africa, which is basically a collaboration between the Treatment Action Campaign, my former employer, and an HIV base. This was started in order to support the advanced study, which was done in South Africa. So we're doing treatment literacy where we're doing trainings and workshops and information sharing sessions with the recipients of care in the communities. This was done by the Treatment Action Campaign trainers and branch educators, and the cascade went this way. Trainers were trained at a higher level, and then they needed to cascade the information down to community level through volunteers. And we developed a lot of materials that were supporting the study. For an example, we had starting ART that was targeted at people who are being newly initiated on DTG-based regimens, and also for switching, that is for people who are already on treatment. And these are some of the materials that we did because of time. Each leaflet, because here it's leaflets, each leaflet had a poster that was linked to it. Basically, the poster had a shorter version of the leaflet, because leaflets tend to have more information, but posters are much more shorter, and these were displayed in health facilities in order to prepare patients for the switch or to be newly initiated on DTG. And these are some of the materials that were adapted, because what we were doing turned out to be something that other countries or other country partners, specifically members of AfroCAP, were interested in. They adapted some of the materials into their local languages, and they have been able to tweak them to their local context. And then we developed an app and a website. The app basically is a tool that contains all the information that is in the leaflets and posters, and it's also found available on a website which you can access at any time. Then during the pandemic, because we couldn't go into communities to do our work, then we decided to become proactive and started doing videos, short video clips that we were uploading on YouTube, because we felt that despite the fact that we can't do the work physically, it doesn't mean that we don't have to do it. So we started a YouTube channel, and people were able to access the information as if we were with them in person. And then we had to fight against the misinformation around COVID-19 vaccines. We felt that even though we are working on issues around HIV, but then this is something that affects us, and people need to get information. So we developed leaflets on COVID-19 vaccines. And then we promoted our resources in the communities. As we said, we're doing community engagements. We went around Johannesburg and other parts of South Africa painting murals with information that had messaging around TLD around TLD. So these are some of the pictures of the activations. So in the activations, we would paint murals and distribute the materials at the same time. And then for IAS 2022, we had a booth and we had information sharing sessions. Yes, that is the work that we have done. For more information, you can access it at the back. We have a very colorful pink book that has all the information. Thank you.